Hello, my name is KaylaLooney, and my presentation will be over several disabilities and their characteristics, as well as accommodations. Let's get started. The first disability I'm going to talk about is specific learning disabilities. Some students may demonstrate low academic achievement in one or more areas. They also may experience challenges in how they learn and process new information. Challenges with reading specifically affect about 80% of students with learning disabilities. Another specific learning disability characteristic is mathematical disabilities along with memory, difficulties with memory, like short-term, long-term, and working memory. This explains why they struggle with academics and more specifically reading and math because memory plays a big role in these areas. Some students may deal with emotional challenges as well, like depression and anxiety, because of the obstacles they face with their specific learning disabilities. So how can I accommodate these students in my classroom? There are many ways that I can ensure inclusion for these students with learning disabilities. Some actions I can take that make a big difference would be to create graphic organizers to help a student stay on task during independent studies. I could also have collaboration with student and parents on the individualized education plan to discuss goals and how we can improve specific skills of concern. I would also like to incorporate technology into the classroom, and this could be through interactive games to enhance the learning process, as well as offer alternative response options like worksheets, verbal or written responses. And lastly, I would apply a tiered curriculum. Next, I would like to talk about a communication disorder. Speech is one of those. Characteristics of a speech disorder fall into three general categories: fluency, voice, and articulation disorders. Fluency disorder refers to unusual repetition of sounds or rhythm known as stuttering. Voice disorder means that the tone of voice is atypical. It could be an unusual pitch, volume, or quality. In students with an articulation disorder, you may notice that certain sounds in their speech are distorted or they may fully forget sounds. Another communication disorder is language. This is characterized by phonology, morphology, syntax, semantics, and pragmatics. You may see a student having difficulty with speech sounds and segments, as well as the usage of some words are incorrect. They also may have difficulty with word order. And some students with a language disorder struggle with pragmatics. This is how we use language in social situations. Students with autism and TBI struggle with pragmatics. So how can I accommodate communication disorders? I will teach students how to interact with one another and provide opportunity for peer relationship problem solving. I would do this by using role play in a variety of scenarios. I would also provide lots of opportunity for writing and small group discussions. Another thing that I would like to do would be to provide alternative response options like multiple choice or verbal responses. Moving into emotional disorders. Emotional disorders can be characterized by one, the child has an inability to learn that cannot be explained by intellectual, sensory, or health factors. Two, there's an inability to create and maintain personal relationships. A student may show inappropriate behavior or feelings under normal circumstances. And a child's mood is persistently unhappy or depressed. They also may show physical symptoms or fear associated with personal or school problems. Next is behavioral disorders. Two characteristics of behavioral disorders are externalizing and internalizing behaviors. Externalizing behaviors are often associated with conduct and oppositional defiant disorder. Here we will see a student that is being consistently disruptive, bullying, fighting, or destroying property. Internalizing behaviors are often associated with depression and anxiety. So if you notice a student becoming continuously withdrawn, it would be important to reach out to this student and offer support, because oftentimes internalizing behaviors are overlooked because they are not outwardly disruptive like externalizing behavior. I think the most important component to ensure inclusion for students who have emotional or behavioral disorders is a positive and structured learning environment. This would include simple and clear classroom rules, reward positive behavior and give positive feedback as much as possible, allow for mini breaks, and use motivational strategies like choice-making opportunities. I would also make it a priority to collaborate with IEP team along with student and parents to talk about test-taking experiences and come up with some test-taking accommodations. It would be equally important to reach out to the school counselor or social worker to discuss warning signs of depression and anxiety that I may be seeing in a student. Okay, so next we're going to talk about ADHD, which is attention deficit hyperactivity disorder. It is defined as a chronic condition including attention difficulty, hyperactivity, and impulsiveness. Characteristics of ADHD may be that a student is easily distracted or lacks focus on goals. A student may be moving around or become fidgety. They also have difficulty determining what to do next. The student may also talk excessively and have difficulty with time management and organization. I would accommodate these students by offering flexible seating as well as the option to stand, and allow for more time on assignments or tests, reward positive behaviors, shortened to-do lists, as well as assist in organization. Okay, next is intellectual disability. There are two characteristics of intellectual disability. These are limitations in intellectual functioning and limitations in adaptive behavior. A student with an intellectual disability has a limited ability in everyday problem solving, thinking abstractly, and remembering important information. A student may have an IQ of 70 or lower. Limitations in adaptive behavior are conceptual skills, social skills, and practical skills. The cause of their significant limitations may include not knowing how to perform a skill, not knowing when to perform a skill, and motivational factors that influence whether skills are performed. Intellectual accommodations could be allowing for more time on assignments and tests, small group or partner participation, and I would also provide the student with notes or taped lectures. Next disability I would like to talk about is autism. Autism is a developmental disability that significantly affects verbal and nonverbal communication and social interactions. There are two general diagnostic criteria for autism: social communication impairments and repetitive restrictive behaviors and interests. A student with autism struggles with taking turns in communication and conversating with peers over shared interests. This can result in having a hard time maintaining relationships. Repetitive restrictive behaviors and interests like verbal and nonverbal rituals, they may get fixated interests that are atypical on objects such as door locks or lights. Atypical language development also is a characteristic, as well as behavioral problems and sensory and movement disorders. Autism accommodations could be something like low distraction work areas, having printed schedules around the classroom. I would also create an area that is a retreat for students that have autism that would be called a sensory retreat space. And I would also utilize classroom aids. An acquired injury to the brain caused by an external physical force resulting in total or partial functional disability or psychosocial impairment, or both, defines traumatic brain injury. Characteristics depend on the site and extent of the injury, and the injuries are classified as mild, moderate, or severe. Students who have experienced a TBI may have coordination problems, fatigue, and physical weakness. The physical changes can improve over time in some cases if rehabilitation intervention is present. Changes in cognitive process occur in brain injuries and cause problems in areas such as problem solving, planning, and memory. Students with TBI can have challenges surrounding emotional and behavioral development as well as social changes. This can result in the inability to build close relationships, and they may have a hard time recognizing emotions. If a young child experiences a severe TBI, this may cause internalizing and externalizing behavioral problems. Ways that I can accommodate students that have a TBI is I could provide both oral and written instructions. I would provide lecture outlines and student study guides, as well as additional time to complete classroom assignments. I would try to reduce the quality of work required to increase the quality of work. It would be great to offer a tiered curriculum also for these types of students. Next is hearing impairments. Hearing loss can vary for a student, and here are some characteristics of hearing impairments. They may have difficulty following verbal directions, difficulty with oral expression, language delay, and difficulty with articulating words. Accommodations for students with hearing impairments are windows and doors are closed to avoid background noise. Seat a student away from noisy objects like heating units or fans. And a student should sit as close as possible where the teacher gives instructions. And also good lighting can be a great thing for students with hearing impairments because it helps them to better read lips. I would also use technology devices to enhance learning like microphones and speakers. Visual impairments describe any kind of vision loss. This can be someone who has partial vision loss or someone who cannot see at all. Some characteristics of visual impairments are limited ability to learn incidentally from the environment, limitations in the range and variety of experiences, limitations in the ability to get around, limitations in interactions with the environment. Accommodations for students with visual impairments. Braille materials and magnifying devices can be very beneficial in the classroom, as well as an organized classroom free of clutter. Also, arrange the furniture to create clear paths and in a way that enhances freedom of movement. It's also beneficial to provide verbal descriptions of visual aids, as well as audio taped handouts and lecture notes. It is important to use tactile models also in lessons to help the students better understand materials. Next, I'll talk about gifted and talented students. They have the following characteristics. High general intellect. These gifted students are intellectually gifted, reaching high IQ scores. They have creativity and leadership ability, as well as visual or performing artistry. Students who have are talented in fine arts, music, dance, and theater are determined to excel in their chosen artistry by creating and performing where and whenever they can. Accommodations for these types of students would be to utilize talents and interests to enhance learning, offer tiered assignments, and encourage real-world applications. Teaching Students with Exceptionalities course has provided me with an abundance of knowledge about a variety of disabilities I may see in my classroom or school. As a future educator, I now have a great foundation in accommodating and advocating for all types of learners. I am inspired to reimagine the traditional classroom and utilize all the resources I have obtained in this class to support inclusion. Thanks for watching.